So in a follow-up meta-analysis to the one that we published on non-relapse mortality, earlier this year, we took a deep dive on the subject of second primary malignancies. Now, this has been a really hot topic after the FDA issued a black box warning on this subject with CAR T-cell therapy, focusing specifically on the incidence of T-cell lymphomas arising after CAR T-cell therapy, positing potentially that insertional mutagenesis may play a role in this. And so we really looked at all the clinical trials, real-world studies, and took a deep dive in understanding SPM, the overall estimate of SPM after a median follow-up of about just more than a year. We find that SPM, indeed, they occur in about 6% of CAR T-cell recipients. And we do not see differences across disease entities or CAR T-cell products. However, when we perform meta-regression modeling, one of the factors that really came through was the number of prior treatment lines. That's one. I'll talk about that in a second. And the second was really the duration of follow-up and the treatment setting. So there's really three factors. Now, treatment setting, as a patient is followed up in a clinical trial, they're followed up more closely for these long-term events, and that is not necessarily surprising. Also, follow-up time, we know that as patients are followed up longer or have a longer duration of follow-up, they have a higher likelihood for developing these types of long-term side effects like SPM. And then finally, treatment lines. CAR T-cell patients, they arrive to therapy currently in a state where they've received multiple lines of prior chemotherapy, systemic therapies. And so when we're talking about the risk of SPM after CAR T-cell therapy, we're actually talking about the risk of SPM after the first, second, third line of therapy, then CAR T. How do we know which one of these therapies the SPM truly relates to? And so I think that this analysis really opens more questions. I think we need longer follow-up on a lot of these trials to really understand this long-term side effect better. We also are able to take a deeper dive into understanding what types of SPMs. We see that myeloid malignancies are actually quite common, whereas T-cell lymphomas, which have a high medial attention, actually were exceedingly rare. And even in the cases where we identified them, a lot of time they were actually not CAR positive. And I think this study adds to the literature, understanding and contextualizing the risk of SPM for our patients moving forward. And probably the most important part of this analysis was actually a subgroup meta-analysis where we looked at CAR T-cell therapy relative to previous standard of care therapies. And we do not see that the SPM estimate is higher in the CAR T-cell arm relative to previous standard of care. So maybe a little bit of caution really about this hot topic of SPM with this analysis.